Abdominal pain, increasing in severity and frequency. Fever, dehydration, diarrhea, weight loss.
I'm dying from kidney failure caused by type 1 diabetes, which has been ruled out.
17 doctors. Everything's been ruled out, which means we have to re-rule out. Get it in history and physical. Unless that's crazy, boss.
Been out of the country or on any recent camping trips?
No camping, but we were in Montreal back in January.
Went to see the NHL All-Star game for my birthday.
Awesome.
Where's Dr. House?
In his office. He's really more of a decider than a doer. He's decided we should start over. Never know what previous doctors may have missed. Like this. Does that hurt more when I push there?
Not really.
What is it?
I'm not sure. He's constipated. Physical revealed a mass in his abdomen, so I repeated the x-ray. Old one was clean, new one shows that his colon's almost completely impacted.
Obstruction would explain the pain. You think they just screwed up the old x-ray?
Nope.
Hirschsprung's? It's a congenital disorder of the nerves in the colon. Very rare in a child your son's age. Most doctors would never think of it.
And you came up with this?
It's House's idea.
We need a barium enema and biopsy to confirm.
Let me guess. It tastes really bad, but it's gonna make me feel a lot better.
Actually, you're not gonna taste it.
Last week, yesterday, today.
I can't believe it. He's pain-free for the first time in months. He's even hungry.
I'm starving.
We're still waiting for the biopsy results, but obviously it's a good sign.
You're gonna want to take it slow and try to regain all the lost weight in one meal.
What's wrong?
His abdomen feels normal, but it looks bigger.
Jack, are you feeling... Jack? Hey, Jack, you okay?
Right eye's fixed. Lateral rectus palsy. He's seizing.
Need 5 milligrams of diazepam.
What? What's happening?
Hold down his head and turn off the lights. Need to see his optic disc.
Heart rate's elevated.
Come on, hold his head.
I'm trying.
Wait, where's House?
Mr. Randall, we need to step back.
His optic disc is swollen. He's got intracranial hypertension. Furosemide, 20 milligrams IV.
We could intubate him. We could
Need 5 more
hyperventilate him.
milligrams of diazepam.
Do you see the monitors? Push 500 milligrams phenytoin.
We can't push that
We've
much.
got to relieve the pressure or his brain could herniate.
Oh, my God.
50 milligrams of phenytoin in.
Page Chase, tell him to meet us in the OR. He hasn't had any more seizures, and cytological examination of the subdural fluid showed no abnormalities.
Don't usually see brain damage after a rectal biopsy.
He was fine after the procedure. No headaches, no mental status change. Wasn't anything we did.
It's not just his brain. He's continuing to build up fluid in his abdominal cavity as well as the dura. We've inserted shunts to drain it.
Gotta be some sort of systemic infection.
Not after spending the last week getting pumped full of IV antibiotics.
You notice anything odd about the shape of the fluid collection?
Oh, God. Virgin Mary.
The edge should be tapered, lens shaped.
Unless the dural layer was already separated from the brain when the fluid started to build up. Get a dural biopsy to confirm brain cancer. Nice catch.
How can so much be wrong with nothing being wrong?
Since when is cancer being considered nothing?
I just said it's not cancer. Cell morphologies were all normal.
And so are the most recent CT scans.
On the other hand, adenocarcinoma of the stomach would cause pain, constipation, nutritional deficiencies that could cause seizures.
It wouldn't show on the CT.
You're right about the cancer. It's wrong about the place. Continue to say nothing if you agree.
Go scope him, get another set of biopsies.
Seizures stopped, but he hasn't regained consciousness. No sign of any masses in his stomach or esophageal lining, and he's still accumulating subdural and peritoneal fluid.
And every time we look to see where it's coming from, he starts seizing.
You think we're setting this off?
I think something is.
One of his stomach biopsies shows an arteriole partially occluded.
But with no abnormality in the other layers and no evidence of a cellular inflammatory reaction.
It's definitely not cancer.
Then it has to be some sort of infection.
We already ruled out infection.
Only because he was treated for it and got worse.
Seems like a sound reason.
Unless it's a drug-resistant strain.
Drug-resistant strain of what? Bacterial cultures, viral serologies, ANA and ANCA are all negative.
Everything's negative. We obviously missed something.
Maybe the seizures aren't a new symptom, they're an old one.
No doctor noticed a thrashing kid.
Abdominal epilepsy. The seizures would just look like pain until it spread to his motor cortex.
Wouldn't explain the fevers.
Protein malnutrition can cause fevers, and nothing causes malnutrition like excruciating stomach pain that gets worse every time you eat.
I'd be a lot more certain if it was my idea. It's the best we got.
Start him on gabapentin. Hook him up to an intracranial EEG for continuous monitoring.
What's up?
Are you Dr. House?
I understand you're a big fan. My guys sent over a signed glossy.
Continuous EEG shows no interictal spikes. It's not abdominal epilepsy.
You paged me to tell me what it's not.
I paged you to show you this.
That I did not expect.
What the hell is that supposed to mean?
Darn it. I know I should have stayed outside. Fantasy is always much better than reality.
You think this is a joke? That's my son. He's dying, and not one of you seem to have the slightest clue why.
I know. That's why it's so interesting. Fever, stomach pain, seizures, peritoneal and subdural fluid collection, and now spots.
Could be an allergic reaction to one of his meds.
That suddenly developed 8 hours after he started the meds.
If it's not cancer or infection, it has to be autoimmune. Systemic lupus, complicated by a CNS vasculitis, would explain the rash, fever, ascites.
CNS vasculitis would cause a stiff neck along with a headache.
And would have showed up on the dural biopsy.
What about polyarteritis nodosa? It can occur in kids.
Except you can't have arteritis without inflammation.
Okay, you come up with something better.
Go on.
There was some inflammation in the skin biopsy, plus he's got elevated diastolic pressure.
It's barely elevated, which you'd expect given the number of procedures he's undergone.
Well, barely is more than not barely.
Not my decision. But if it was, I'd say start him on prednisone and get a testicular biopsy. If he's gonna have any real inflammation, it'll be down there.
Cameron and I will do it.
Why? It was Chase's idea.
Kid's father's not gonna be happy about a 4th set of biopsies, and you've got a better rapport.
What's really going on here? You need Chase to help you over-prep for the M&M?
Yes.
Then say so. Don't be a child.
Is it on his penis? Kid's rash?
Yeah, why?
Means it's most likely affecting the small blood vessels. That's why we didn't see any inflammation on the biopsies. It's not polyarteritis. It's to-go disease. I'll do it. Your son has to-go disease. Causes micro blood vessels in the brain, skin, GI tract to break down, clot off. It sometimes manifests early on with atrophic papules on the penis. In your son's case, we don't know why, but they came much later.
What's the treatment?
There isn't one. It's incurable.
You're wrong. You've already been wrong a bunch of times.
We rechecked the biopsies. It's definitely to go. I'm sorry. I wish there was something we could do.
How long?
Not much longer.
What does that mean?
Day at the most.